Good evening, doctors. Welcome again. Today we are going to discuss about ECG image-based MCQs for Neet PG 2020 exam, and for all exam these are very helpful. So guys, this kind of ECG we see flutter waves, fibrillating waves, F waves, no P waves are here, and irregular rhythm. So this is a case of atrial fibrillation. Yes, ECG in atrial fibrillation, hallmark of atrial fibrillation is absence of P waves, means no sinus, and irregular, totally irregular ventricular rate. Baseline isoelectric line between QRS complex is characterized by either fibrillating waves or F waves or just minute oscillations. Hope till here this atrial fibrillation is clear. Atrial fibrillation, remember, no P wave means not sinus rhythm, and irregular RR intervals are different. So this is irregular and fibrillating waves are present. So this is atrial fibrillation. Okay. Now see this rhythm. Sawtooth appearance here. So this is a case of atrial flutter. Rhythm is regular. RR intervals are regular here. So hope it's understandable for you. Now see this kind of ECG. What kind of picture you find here? Write me in comment box. This is atrial flutter. Same atrial flutter, and this is also atrial flutter. Okay. Atrial flutter is characterized by sudden onset of usually regular abnormal heart rhythm on electrocardiogram in which the heart rate is fast. It is typically not a stable rhythm and often degenerates into atrial fibrillation. See guys, this is atrial flutter. This is atrial flutter. Atrial flutter. Okay. Now, what is this? This is tachycardia. Which tachycardia? This is ventricular tachycardia. Yes. And this is also a tachycardia, ventricular tachycardia. See, ventricular tachycardia is looking like this on ECG. Refers to a wide QRS complex heart rhythm, that is a QRS duration beyond 120 milliseconds originating in ventricles at a rate of greater than 100 beats per minute. This can be hemodynamically unstable, causing severe hypotension and can thus be life threatening. So guys, revise this again. This is tachycardia, ventricular tachycardia. Remember ECG. Now, what is this? This is also tachycardia, but what tachycardia? This is supraventricular tachycardia. Supraventricular tachycardia, it's looking like this. ECG, P waves are often hidden, being embedded in QRS complex. Pseudo R waves may be seen in V1 or V2. Pseudo S wave may be seen in lead, second, 3, and AVF. In most results is typically SVT, supraventricular tachycardia, with absent P waves and tachycardia. So guys, I hope SVT clear. SVT is looking like this, supraventricular tachycardia, whereas ventricular tachycardia is looking like this. So remember the differences between both. Okay. Now, what is this rhythm? This is fibrillating ventricular. Yeah. A rapid and irregular activity renders in ventricle unable to contract synchronized manner, resulting in immediate cardiac loss output, and heart is no longer effective pump, so it reduces carrying mass. Okay. What is this? This is ventricular flutter. Ventricular flutter is an arrhythmia more specifically affecting the ventricles with a rate over 250-350 beats per minute, and one of the most indiscernible. It is characterized by ECG by a sinusoidal waveform without clear definition of QRS and T wave. See, ventricular flutter is looking like this. Okay. Now, what is this? We see here delta waves seen in Wolff-Parkinson-White syndrome. When an individual is in normal sinus rhythm, the ECG characterized of WPW are a short PR interval less than 120 milliseconds in duration, widened QRS complex greater than 120 milliseconds in duration, with slurred up stroke of QRS complex and secondary repolarization changes reflected in ST segment T waves. Okay. What is this? This is Mobitz type 1 Van Bach, we can say. This is type 2 AV block. This is Mobitz type 1. Their PR interval constantly enlarged, and then there is a pause of QRS complex. No. So this is Mobitz type 1. Type 1 second degree AV block, also known as Mobitz type 1 or Van Bach periodicity. It is almost a disease of AV node. Today, Mobitz 1 heart block is characterized by progressive prolongation of PR interval on consecutive beats followed by blocked P waves, dropped QRS complex. Okay, now this is Mobitz type 2. There is no constant enlargement of PR interval, but PR interval, prolonged PR interval, then pause QRS complex constantly, not increase PR every interval. So this is Mobitz type 2. In second degree AV block, also known as Mobitz type 2, is almost always a disease of distal conduction system. Purkinje of Hayes system. Mobitz type 2 heart block is characterized by on a surface ECG by intermittently non-conducted P waves, not preceded by PR prolongation and not followed by PR shortening. Okay. Now 2 is to 1 block, 2 P waves, then QRS complex. This is 2 is to 1 block. In the case of 2 is to 1 block, 2 P waves for every QRS complex, it is possible to differentiate type 1 and type 2 Mobitz block based solely on the PQRS ratio or on the pattern of. Okay. What is this? This is a case of MI, second and third lead ST elevation we see, and in AVF. So this is inferior wall MI. See in second ST elevation, third lead ST elevation, AVF ST elevation, and so this is inferior wall MI. Inferior myocardial infarction includes ST segment elevation in second, third, and AVF. Reciprocal ST segment depression in lateral high leads like first AVL V5 V6. Okay. What is this? This is also a case of MI. We see V3 ST elevation, V4, V2, and V5 ST elevation. So this is a case of anterior wall MI, anterior myocardial infarction wall ST segment elevation in anterior leads like V3 and V4 at the J point, and sometimes in the septal or lateral leads depending on the extent of MI. Reciprocal ST segment depression in the inferior leads second and third and AVF. Okay. In lead V2, V3 and V4 there is ST elevation we see in posterior wall MI. ECG on acute posterior wall MI includes the ST segment depression, not elevation, in the septal and anterior periodical leads V1 and V4. This occurs because of these ECG leads will see the MI backwards. The leads are placed anteriorly, but the myocardial injury is posterior. Okay. What is this? ECG represents CM waves in V1, V2 and V3, and W waves in V5, V6, V4. This is right bundle branch block. And see this W waves in V1, V2, V3, M waves in V5, V6. So this is left bundle branch block. And this is sinus bradycardia because P is present and bradycardia. First degree AV block, what is this? There is prolonged PR interval constantly. So this is known as AV block, first degree. Here is the picture which discusses Mobitz block all. First degree PR interval prolongation, second degree AV block part 1, that is Mobitz 1. This is constantly increased PR interval then pause QRS, and there is no prolongation of PR interval and pause QRS is second degree. AV block Mobitz 2, and 2 is to 1 is 2p followed by this, and third degree AV block is this is third degree AV block. So guys, I hope till here it's very much clear for you about ECG. These are the very high yield MCQ, lot of probability to receive in your exam. If you have any queries, any question regarding this, you can ask me. And if you still not subscribe my channel, subscribe it. Thank you, good day, goodbye. That's all for today. And if you like this video, put like on it.